Yo, I don't think we should talk about this.
Come on, why not?
People might misunderstand what we're trying to say, you know?
No, but it's a part of life. Come on.
Let's talk about sex, baby. Let's talk about you and me.
Hey guys, did you know that apparently 1 in 8 Australians is estimated to be affected by the HSV2 virus? That's better known as herpes. That's a lot of people. Did you know that viral sexually transmitted infections, or STIs, such as herpes and HIV, aren't actually curable? Viruses like these may lead to ulcers and lesions and an increased susceptibility to other infections. Over the past decade, we have seen STI rates increase dramatically in Australia. STIs are mostly contracted through unsafe sexual practices, like not using condoms, and sometimes don't even show any symptoms. The likelihood of contracting an STI does vary according to sex and age, and predominantly affects younger generations. However, incidence is increasing for older generations as well. STIs can be spread and contracted in a number of different ways, such as body fluids, blood, vaginal fluids, and semen, and also through contact with infected skin, anal and oral sex, and sometimes contaminated needles. STIs aren't always accompanied by symptoms. However, some to look out for include sores and blisters on the genitals and/or mouth, pain or burning during urination, unusual discharge from the genitals, itching and swelling in the pelvic area, and sometimes fever and chills. It is recommended that you go and get an STI test after any unprotected sexual contact. That can be with a new or casual sexual partner, or even if you know or suspect that your partner has had other sexual partners. You should also get tested if your partner tells you that they have been diagnosed with an STI. You should also go and get tested if you are experiencing any of the symptoms that we described earlier. Regular annual checkups are also recommended. Although bacterial STIs are usually curable, if left untreated, they can have some very serious long-term consequences. Some of these consequences include infertility, chronic abdominal pain, genital damage, brain damage, and heart damage as well. So what should you do? The only way to find out if you have an STI is to go and get a sexual health test. STI tests are pretty easy to do. In most cases, it involves only a simple urine test, sometimes a blood test, and results should get back to you within a week. Thanks for watching, guys. You can follow us on our Facebook page, Twitter page, or our Instagram as well. All your views and likes are much appreciated by all of us, so thank you so much. Remember to stay on top of your sexual health. #test before you undress.